Saving lives one at a time. An evaluation of the GH method and viscoplastic medicine theory in extreme mortality cases, number 1374, VMT Sharp 715, October 2, 2025. Gerald C. EclaireMD Foundation. Category, Methodology, Neuroscience, and Oncology. Mission statement. I write these medical papers not for fame or recognition, since I have already lived a long and successful life, though not always a healthy one. My purpose now is to share what I have learned about health, disease, and medicine, so that others can better understand their own conditions, prevent illness, and live longer, healthier lives. Abstract. This article reviews and evaluates the unique contributions of my GH method, math physical medicine, MPM, specifically, the viscoplastic medicine theory, VMT, energy model, as applied to extreme mortality, conditions such as stroke and cancer, drawing upon more than 4 million self-collected data points, spanning 16 years and over 1,373 self-authored medical papers. My research approach departs from traditional statistical cohort studies. Instead, it emphasizes nonlinear, dynamic system modeling and personalized data-driven analysis. This evaluation highlights the MPM-VMT method's effectiveness, its practical, life-saving applications, and its potential to complement existing medical paradigms by shifting some focus from population averages to individualized prevention and intervention. Introduction. Traditional medical research overwhelmingly, more than 90%, relies on statistical methods, such as hazard ratios, correlations, regression models, and population averages. These approaches are valuable for identifying broad population-level risk factors, yet they are less effective in guiding immediate, personalized interventions, particularly for extreme mortality, conditions such as heart attack, stroke, and cancer. Between 1972 and 1976 at MIT, my academic advisor, Professor Norman Jones, taught me how to analyze hostile dynamic loading on structures and engines. Sudden impacts can cause permanent plastic deformation. The material absorbs energy, but at the cost of irreversible damage on structures or engines. This engineering principle of irreversibility, once a structure deforms beyond its elastic limit, it cannot return to its original state, became a foundation for my later medical research after my health began to deteriorate in 2010. Since then, I have applied my background in mathematics, physics, engineering, and artificial intelligence, AI, to develop a new medical framework, the GH method. Beginning in late 2020, I anchored this approach in the viscoplastic medicine theory, VMT, energy model. Just as materials under extreme dynamic and nonlinear stress undergo irreversible deformation, the human body under a similar dynamic and nonlinear chronic or acute stressors can experience irreversible biomedical damage, such as vascular rupture in stroke or DNA mutation in cancer. Using this analogy, I have produced more than 700 medical research papers, based on VMT method, demonstrating how dynamic, nonlinear energy modeling can more accurately reflect chronic disease and certain mortality diseases, progression and guide real-time, personalized interventions. My recently written paper number 1373 illustrates this approach with quantitative ratios for stroke. 91% over earlier 20 years with medication versus 9% over recent 16 years with lifestyle management, and cancer. 55% reduced to 45%, capturing the difference between short memory, vascular damage for stroke and long memory cellular damage for cancer. This work provides not only a scientific framework, but also practical, actionable tools for individuals at risk. Methods and approach. Hyper-personalized data collection. Since 2010, I have compiled an extensive dataset of approximately 4 million measurements, averaging from 120 to 150 daily health metrics. These include glucose, blood pressure, weight, food intake, sleep, stress, and exercise. This real-time data collection enables me to track both acute triggers, such as an acute hypertensive spike at 175 mm of mercury, leading to my hemorrhagic stroke in June 2025, and long-term cumulative patterns, such as inflammation driving cancer risk. Viscoplastic Medicine Theory, VMT. The VMT applies principles from viscoelasticity and viscoplasticity to model the human body as a nonlinear and dynamic system. Stroke can be framed as a short memory condition, sensitive to acute stress and partially reversible. Cancer can be framed as a long memory condition, where accumulated DNA damage creates persistent, largely irreversible risks. This dynamic systems approach contrasts with the linear, reversible assumptions embedded in most statistical models. Drug-free lifestyle interventions. After discontinuing medications in 2010, I relied on lifestyle interventions, low carbohydrate diets, daily walking of about 15,000 steps, improved sleep, and emotional stress control. Although stress management has been challenging and contributed to my recent stroke in 2025, these interventions still produce significant improvements. Hemoglobin A1C was reduced from 8 to 12% to 6 to 7%. Visceral fat was lowered, and blood pressure stabilized. Artificial intelligence and predictive modeling. Leveraging my training under Professor Patrick H. Winston at MIT in 1972, I integrated neural networks, pattern recognition, and nonlinear AI modeling into my medical research. My predictive models achieved from 95 to 99% accuracy in glucose forecasting in earlier studies, and now extend to stroke and cancer risk predictions. Results and life-saving impact. Stroke prevention. By shifting from medication-based management, from 1990 to 2009, to lifestyle management, from 2010 to 2025, I reduced my stroke VMT energy ratio from 91% to 9%. My models highlight the sensitivity of stroke to acute events, allowing preventive interventions such as emotional stress, control and diet adjustments before dangerous blood pressure spikes occur. Cancer risk mitigation. Although cumulative DNA damage cannot be reversed, my approach slowed further progression, reducing the cancer VMT energy ratio from 55% to 45%. By controlling glucose, reducing inflammation, and maintaining body weight and visceral fat levels, my work demonstrates that lifestyle can delay the onset of malignancy, potentially extending survival for high-risk individuals. Practical demonstration. My survival of multiple cardiovascular episodes, kidney complications, diabetic neuropathy, retinopathy, and most recently, a hemorrhagic stroke underscores the practical value of my approach. My data-driven lifestyle adjustments provided resilience that population-based guidelines alone could not deliver. Discussion. Why my approach adds value beyond statistical cohort studies. Individualized focus. Cohort studies average out variability across thousands of patients, while my N is 1. Dataset captures unique triggers and patterns. VMT implications. It accounts for nonlinear and partly irreversible system processes, offering more realistic representations of chronic disease mechanisms. Actionability. Statistical findings often take years to inform guidelines, whereas my predictive and viscoplastic AI modeling provides real-time interventions that can prevent acute events. Ethical and humanitarian dimensions. My self-experimentation ensures no harm to others. By publishing nearly 1,400 papers, I have made my findings accessible to both professionals and patients, democratizing knowledge that may save lives. My focus has always been on helping individuals live longer and healthier, rather than seeking recognition or institutional rewards. Scaling potential. The GH method and VMT can be scaled through digital tools, AI-powered apps offering personalized alerts, for example, reduce carbohydrate sugar intake by from 15 to 30 grams to lower stroke risk. Integration with wearables for automated continuous monitoring. Educational outreach to distill my findings into simple, practical protocols for patients and clinicians. Assessment of contributions. I believe my contributions to medicine and patients are meaningful in several ways. Interdisciplinary innovation. By bridging mathematics, physics, engineering, AI, and medicine, I have created a methodology that applies engineering rigor to biomedical uncertainty and complements existing medical approaches. Extensive data commitment. My personal dataset of approximately 4 million data points provides insights that population-based studies cannot capture at the individual level. Patient-centered focus. My goal has always been to save lives, one at a time, shifting the focus of research back to patients. My own survival stands as evidence of its potential usefulness. Ongoing knowledge dissemination. With more than 1,373 single-author papers written, my work builds a cumulative, accessible library for both professionals and patients. Conclusion. Both my GH method, MPM, and the Viscoplastic Medicine Theory, VMT, represent an attempt to move beyond linear, statistical views of medicine, by emphasizing individualized, dynamic, and nonlinear system-based modeling, supported by personal data and AI-driven predictions. This work offers practical pathways to preventing stroke and delaying cancer. My aim is not to replace traditional medicine, but to provide complementary insights and tools that directly serve patients, enabling timely interventions that may save lives. Disclaimer: this content is provided for educational reference only, and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article, and its related materials belong to the author, Gerald C.